Well, thanks for having me. I'm gonna take you through a little bit of the my One Health journey, and talk about, as Gigi mentioned, the Predict project a little bit, and then where that's gone, and what I think it's doing to help with our global health security, and what One Health can actually do in a university environment. In case I know that you guys have great activities, and I've been able to consult actually with Megan Davis and others there for almost a decade, on that, which has been really fun to see that growth. And I think our university has decided to take it to beyond health, to sort of solving the world's wicked problems, if you will. So we'll just go through some of that. And I do, there are several definitions now. This one's slightly older than the UN based definition that is quite good, but quite long. So not very conducive to putting on a slide. What I like about this working definition of One Health is that it has plants. I thought it was a big step when we added plants, separate from the environment. So thinking about food, I think, is incredibly helpful, and it is a real uh, important as well as useful paradigm to use One Health when we're thinking about food systems. What I think all of the One Health definitions are missing right now is a focus on equity. There's a little hint in the sort of WHO-based UN definition towards equity, but nobody's coming out and saying really clearly that we need to have a focus on equity when we're thinking about health and the interactive health of humans, animals, plants, and the shared environment. And I think that's, smacked us in the face, right, with COVID-19. And I think we really need to think about it more. So anyway, I think the central tenets of One Health are that it's collaborative and that it's thinking about the intersections of the different moving parts that all affect the health of whatever population you're thinking about at the time. Um, uh, I put just a short list on the right there of some problems that we think about when we think about One Health. I am going to be talking to you because it's my area of expertise about zoonotic disease emergence and pathogens. But I don't at all think that's the limit of One Health, and I'll show you a little bit more about that. But what's super important, and again, doesn't always come into the definitions, are these drivers and influences. And I kind of believe that if we were to go upstream from the problems on the right and look at instead the drivers and influences, we'd have a much, much better chance to actually take a big bite out of the world's big problems like the climate crisis. And frankly, when I think about health and I think about climate, I think we are kind of sometimes fighting each other. The environmental sector and the health sector are kind of fighting each other for attention when we would do so much better if we combined forces and talked about these things in a more integrated way. I think it will be more instructive and useful for the general public to understand where we're going, which frankly, we're on a path to our own species extinction right now if we don't make some changes. And I think that we can grasp that better if we're talking about these things more holistically. And I'd love to see the environmental community and the health community come together for better advocacy. And actually, Ari, one of your students and my previous mentee, helped with some of that when she was with us here in Davis. All right. So, but when we think about zoonotic diseases, I think, we can document how many new viral diseases there are in people each year. When I started working more and more in public health, I should say I'm an epidemiologist, but I also have a veterinary degree. And so I started really in wildlife conservation and was noticing that we had so much pathogen pollution that was affecting people and animals, and that the animals were really sentinels for increased exposure. And it got me sort of working more and more into the human side of the One Health domain. And when I started that, probably about 15 years ago, moving more from conservation into more strongly public health, we could document about 3 new viral diseases of people each year. We're now seeing on the order of 5 when we control for better diagnostics and better surveillance. So it's going up, even though we're getting better, right? So sometimes it's just we think it's going up, and it's just we're better at detecting. And sadly, that doesn't seem to be the case if we control for effort. And it's going to continue to change. Why? Because we are incredibly prolific organisms, and we're increasing our numbers. And even as we see in the highly developed world, the population numbers coming down, we're still pushing into habitat to find things like elements for our cell phones to make them faster, lighter, stronger. So we're moving ourselves into more and more pristine habitat to extract resources, farm to feed all of the people. And as we do that, what do? We bring many people, and we bring our companion animals and our food animals. And when you bring more and more animals, including humans, into what was previously more pristine habitat, you have the opportunity for exposure to organisms that and viruses that were potentially not pathogenic at all in their system to any of the species that they've evolved with. But now we are very susceptible, or our chickens or our cows, and the viruses can change and become important for both the food supply and human health. So when we think about spillover, so that concept of spillover, we can think about the evolution of viruses in their animal hosts, then the cross-species transmission opportunity or spillover, and then the really dangerous part for humans is when viruses become human-to-human transmitted, of course. And again, back to those drivers and influences, the human pressures are really what's driving these processes, right? So the wildlife in the pristine environment are not jumping out and coming into cities to attack us with their viruses. And similarly, those viruses aren't just hanging out waiting for a human to come by. It's us and what we're doing to the earth and our footprint and how heavy we walk on it that is putting us at risk. Now, I'm not one to believe that we can eliminate every spillover, and I don't think that we should stop doing surveillance really well and keep increasing our proficiency at detecting new viruses in humans, especially sick ones. But I do think that we have the ability now, we have all of the technology and in much of the world, the cooperation needed to be able to identify new viruses, understand their hosts, and stop them from spreading at their source by having good diagnostics and health systems in place so that we can actually quarantine and stop things. That has a lot to do with politics. And we saw that we had a major fail of that in basically every country, even the countries that started out really strong and had the cooperation of their people and things at the beginning of the pandemic, lost that, and it got out of control almost everywhere, right? When we started the Predict project in 2009, is that right? Yeah, in 2009, we knew ICTV, or the International Convention on the Taxonomy of Viruses, would recognize about 260 known zoonotic viruses, okay? So not just infection, but making people sick, because that's how we used to identify them. We would only identify them once they made us sick, and then we'd figure out what they were and where they came from. What we were able to do with the Predict project that I'll show you just briefly here is that we were able to sample enough individual species of wildlife in enough different systems to document about where we saturate the curve for different kinds of host animals of the detection of how many viruses they have. So as you start to sample them intensively, you see that you have almost an exponential discovery curve, and then that levels off. And that differs for the different taxonomic classifications of viruses. For example, coronaviruses are more, we can find more of them than we can filoviruses. But you can start to saturate that curve. And to do that, we identified that there are probably at least 500,000 viruses still to be discovered that can spill over and infect people. Now, that doesn't mean that all of those will make us sick, right? But we can be infected. And once we can be infected, then we have to think about recombination with similar viruses, and how those viruses can evolve in us, as well as evolve, as I mentioned, in some of the animals that we bring into systems, and there can be remixing. So we're all little remixing vessels for these viruses. So when we started this sort of ambitious project to do capacity strengthening in some of the hotspots of spillover in the world, we tried to sort of build a strategy. And frankly, we were building that plane while we were flying it, right? Because we were selected as a consortium by USAID to sort of figure out how do we forecast these hotspots and what do we do about it? Where do we intensify surveillance? Where do we intensify our ability to react quickly? And so we sort of looked first at the zoonotic pool of viruses. So the green area here is like what species are most likely to interact with people, what species viruses are most easily jumping host to host, especially into human hosts. And then, so we started there. And we also wanted to look at that sort of triad of the evolutionary host, generally wildlife from my perspective here, and then the potential hosts in domestic animals. And I say potential because we, like our own viruses that we have become very adapted to, we know a lot about those. And we know more than we know about wildlife viruses, we know about domestic animal viruses. To some extent, we know more about domestic animal viruses than we know about human viruses, frankly. The veterinary community knew about coronaviruses in livestock for about 70 years before the first person was diagnosed with a coronavirus, even though we know now coronaviruses are often like our common cold. So because we eat them and because they have a lot to do with our economic security, we've studied the domestic animals quite a bit. So it's really the green area where we weren't really getting that information. But once we have an outbreak, and this is a very optimistic one that ends in 60 days, once we have that outbreak, we want to be able to reduce the blue and the red curves, right? And I think what was happening is we were coming in with vaccines at the end of outbreaks. So spending millions and millions of dollars to address outbreaks that were basically over because we weren't doing the work at the left-hand side to be ready for them before they come and to have the diagnostics ready for unknown viruses. And that's where we really wanted to get better. We wanted to understand what was going on, have the ability to detect early, and then therefore have the ability to intervene and reduce those curves and get some benefit of control. To do that, we looked at a lot of high-risk interfaces. People think, people are probably not all people like you, but family members or things are like, oh, you're traveling all the time to exotic places. I'm like, yeah. They're not exotic places that many of you would want to go on vacation to, although I learned so much and loved the people that I met and got exposed to cultures that I probably never would have. But basically, we're swabbing a lot of butts. It's not sexy work. mouths too, but it feels like, it's not what your family's thinking when they go away. And speaking back to the teenager thing, I did take my teenagers with me to some of these places and made them work. And then they're like, oh, okay, you work really hard, you never sleep when you're gone, and you're doing a lot of gross things. But all right, mom, and so I think that was healthy. Anyway, so I just a couple of items. What I found really shockingly optimistic about the human condition is the people in these communities were so willing to work with us. So, for example, in the lower left, I kind of call that the influenza mixing. The chickens above the pigs, where the pigs are obviously eating the chicken feces. It's kind of similar to the one above it that is more like invokes MERS there. It's not just the animals that you see being housed, but all the critters that you can't see, you don't notice, the bats in the corners, the rodents and shrews that are running around getting scraps. So those are also coming right into the houses of the people on the upper right. The lower left is actually a photo taken right in the household compounds of the folks on the upper right in Kathmandu. And not only are the rodents and shrews going back and forth and often taking little snips of food out of the kitchen, sometimes biting fingers, but they're also taking the sick chickens and pigs and other small animals into the home with them at night so that they can live. In the middle there, you have a bat guano encouraging farm. Basically, if you build them a condo, the bats will come out of the forest and give you fertilizer. You can see it there on the ground there. And we couldn't just say to people, stop that livelihood that you're using to live while you're a fertilizer seller and likely a farmer, and putting that straight onto your own crops and taking them to market. But we wanted to work with them to say, is UV irradiation, what you're doing to dry it here, is that killing the viruses that we're worried about? And in many cases, the way some farmers were doing, it was much, much safer than others. And so we were able to learn and help them be safe for themselves and their families, as well as the food that was going to market. So again, we wanted to look at that zoonotic pool, or the green on the other, have that early recognition, but we also wanted to look at syndromic surveillance of people that were interacting, like the bat guano farmer, and see if we could start to triangulate with the livestock. We looked at sick people, but also people in occupational risk that weren't sick. Again, trying to get a start on what viruses were being shared. And this is just sort of the outcomes. I think I call the PREDICT project one of the biggest pilot studies ever from my perspective in science. So we spent about $200 million working in about 40 countries, 30 substantively. And we were able to, I think, really helpfully start to saturate that discovery curve and understand how much work and how much money it would take to actually understand what about all the viruses out there available to infect us. And we were able to strengthen about 60 laboratories to be able to do viral detection and discovery in sick people, as well as for their surveillance. And that generally ended up being about 2 labs per country. In some very progressive countries, we had One Health laboratories, but in many countries, we worked with the National Livestock Lab and the National Human Health Lab, right, to get that technology going. Better than I would get now if I went to a hospital and was sick. It would probably take lots of time between when they ran every test known before somebody did viral discovery on my sample. And so the attitude about how to do it when you don't have a ton of viral tests sitting on the shelf and you could go straight to the viral discovery was a pretty interesting concept. So I think that laboratory strengthening and the exposure to One Health and the training of 7,000 folks in the One Health paradigm was probably the most important thing. But the sexier things is, yes, we sampled 164,000 individuals, humans and animals, non-human animals, and we detected about, now it's up higher than this because people kept going with samples after the project, but over 1,100 viruses. Important there is more that 80% of those viruses were not yet known. And they were in viral families that were the source of epidemics and pandemics previously. Also in the known ones there, really importantly, we were finding bad actors like Marburg in countries that did not know they had Marburg. So as you guys know, the West African horrible tragedy with Ebola, the appropriate response was severely delayed because people were like, we don't have Ebola. So they weren't looking for Ebola and they didn't have the capacity to test for Ebola. So hopefully that's much better now. And by looking at these knowns, but in different communities where they're not expected, we help the clinicians be prepared and have on their differentials these diseases. And in fact, after we found Marburg in a country, it was diagnosed with one case in a hospital in that country before they had any kind of severe outbreak. So we're very proud of that. Now, one other thing is the 7,000, nearly 7,000 One Health workforce trained people in the countries where we work is now dramatically dwarfed. So I'm really honored to be able to say I was able to work with the One Health Workforce Next Generation project. The PI and director of that is Professor Valtrina Smith, also at Davis. At the very beginning of that project, I was the director of that project too. And I think there are over 100,000 people trained because what we were able to do, again, with the help of USAID, is help to build curriculum in much more than 100 universities throughout Southeast Asia and Africa. So now that's being amplified, and hopefully we'll see the proof of that investment being useful. Now, for those of us who are academics, we were able to also, have good success with publications, including places like Nature and Science, getting great papers out, often getting papers out for those partners that we worked with in those countries as first author, often being the first people to publish on a filovirus or a coronavirus in their countries. This particular one, way before the SARS-CoV-2 outbreak, we were able to document that the ACE2 receptor was important and that you could get these viruses directly from bats without an intermediate host being necessary. That became very useful during our horrible pandemic. And everybody then knew what an ACE2 receptor was. So there was a lot of contributions there. Also, at the beginning of the pandemic, we were able to go to our data and work with our health security, national and global health security, to say, look, the most likely hosts of these viruses are bats. You can see that the most coronaviruses that we found hosted in bats. So that helped to give it sort of a direction to study the origins. And if we dive into Sarbeco coronaviruses, or SARS-related beta coronaviruses, we could see that the majority of the bat hosts were rhinophilid and hippocytarid bats, or the microbats that are insectivorous. So sort of giving more direction of where to look, and also where to be worried. So one of the things that I think was super important that maybe as biologists and epidemiologists and health professionals we're aware of is that we should be thinking about the evolutionary hosts and their home range and recognize that there is exposure risk across those home ranges. Now, if you don't know which animals are the evolutionary hosts, you're in trouble, but you don't need to sample every single location and for every single virus. If you start to sample the hosts and understand where they go and what they have. And so this is just an example of that. These are the SARS-related coronaviruses, the home ranges for the majority of the ones we found on the left. And then if you look on the right, that's that most prolific host star, Rhinophilus affinis that we found. And so we were able at the beginning to say, hey, don't just be worried about Asia, about China. You need to be thinking about all of Southeast Asia. And then speaking of not just China, looking in Vietnam, our teams in Vietnam did some wonderful work looking at the risk and where we find the most risk and moving through and amplifying risk. So here you can see that just about 20% of rodents in Vietnam could at any time be shedding coronaviruses. And then when we put them into the stress of going into the human value chain and go to market, and they mix with other species that may also have coronaviruses, and this is logic, none of this is rocket science if you really break it down and think about it, but we saw about a third of them then they're in tight quarters, they're mixing, right? They're exposing each other, they're stressed, so they're shedding virus. So we saw about a third of them at the time that they were getting to large markets. Now, the really worrisome thing, then they spend time in the markets, right? Interacting with humans and with other animals, and then go to a restaurant where they're generally bought live and butchered at the restaurant. By the time they were being butchered in that kitchen and served to guests of restaurants, it was over 50% of them had coronaviruses. So this is what I'm saying. These viruses and these animals aren't jumping out to give us their viruses. And we can't control that by killing all the hosts, right? It is our behavior and what we're doing with these animals and their viruses that are putting us at risk. So during the pandemic, I just have the different sort of assistance that the people who had worked on the Predict project were doing in their countries. As I mentioned, in East Africa, way before the virus even got to East Africa, we had folks helping with PPE. We had people on their presidential and prime minister task force, again, because they were the only people in the country often who had studied and written papers about coronaviruses. In places like Cambodia and Thailand, we saw the teams there diagnose the very first introduced cases of SARS-CoV-2 before we knew it was SARS-CoV-2 and before we had a full sequence. So they were able to put in best public health practices, focal follows, all of that work, quarantine, before it got out of control in their countries. And then things changed again politically, and that whole system broke down. But in those countries, I was so excited that they were diagnosing the very first introduced traveler coming into their countries using what they learned along with me learning and the whole team from Predict. We were also able to do a lot of community outreach as we were finding more and more viruses of concern in bats. We didn't wait to come back to say, here's every single virus you should be worried about. Instead, we worked to actually put together materials and deliver those materials in community meetings and in books on how to live safely with bats. And we did an Asian style version and a African version. And then that book was translated at last count that I knew of into 12 languages for publication, but it was delivered in hundreds of languages as people translated it at public meetings. So, where do we go now? Well, first and foremost, I think we have to be very, very cognizant, and we were very focused on safety in the Predict project, how to do this safely, how to build capacity. We actually put together, I think, 35 different guides and protocols that include safety for inactivating samples, how to transport them safely, how to work in laboratories with inactivated samples to reduce risk. But things have changed again, and the surveillance, even though we have the ability to find these viruses and know about them ahead of time, we're not doing that very much right now. And there are lots of reasons for that, and we could talk later in the Q&A. But so that's a concern. I think surveillance has diminished in many, many countries, and we can't do that because then we're just sitting back waiting to have another one hit us and hope we can respond. I've been working with CEPI, which is a great international organization that was stood up before the pandemic to really help get viruses, get vaccines made to viruses that mostly affect people who couldn't afford to buy viruses, so not commercially viable. And they now are using the Predict data and the platforms for assessing the risk for viruses to actually optimize pipelines for vaccine development so that any virus that hits us can have a vaccine developed within 100 days of that case, or even an early warning of a case coming our way. So that's very exciting. They came to us because we had started trying to assess not just on virologic factors, but also on host and environmental or behavioral factors, what viruses are most likely to spill over. We used the Predict viruses first, and now we're working with CEPI to actually bring in every virus in GenBank into this platform to try and assess risk of, these hundreds of thousands of viruses, millions of records of them. And what it puts out is basically a risk score, kind of like your credit score. And you can look at what's contributing most. Is it the virus factors, the environment factors, or the host factors? As a gut check, SARS-CoV-2 came up as the top one. So this is not because we built it to look at known viruses, but we wanted to put in some known viruses to see how they ranked, and that this one came out highest. But what I think it's very useful, besides the vaccine pipelines, which it's already being used for, a country could put in their own country and pull up the viruses that have been found in their country and the relative risks of those. It could look at hosts in their country and other watch lists. This is a global one, but a coronavirus watch list. Just if you're a coronavirus researcher, you can also pull it up. Now, the public interface right now is still just primarily the Predict viruses and a few zoonotic viruses. I think about 80 zoonotic viruses that are known, again, for that gut check. But the new version that we're working on that has all the viruses will have a bit of a different interface. All right, and so what's left? How much would it cost us? Before the pandemic, we estimated that it would cost us about $4 billion to find all the current viruses circulating in the world, using a combination of the techniques that I've talked about. And we're able to forecast where the most undiscovered to humans viruses that are zoonotic were left to be evaluated. And the Amazon basin was certainly the hottest spot based on the work that's been done so far. If you look here, can you see that video playing where we're looking at the forecasted destruction of the rainforest and desertification, which hugely affects our climate, right? And is affected by our climate, but it's also the people moving in to deforest so that they can farm in that area. And it's, I can play it one more time, but it's at that border as it's moving that we see the highest risk. So we were able to look during Predict at pristine environments, urban environments, and that buffer zone as things are being changed. And it is at the buffer zone where everybody is out of their element and stressed out that we see absolutely the most shedding and the best opportunity for spillover. Now, the urban environment is the worst scenario for spread when something especially has become human to human. But this begs the question, should we be looking more in the Amazon rainforest, both to protect it, to say, hey, there's viruses here, don't go in there, don't cut it down, right? Using that argument, as well as thinking about how we might find the viruses there, but not bring them out of there, right? So we don't, one, want tons of people and equipment running through the Amazon rainforest in its pristine, because it's not good for the rainforest. And we don't need the people being exposed and taking the viruses out to laboratories all over the world. And so there's a group called the KAA Initiative that's looking to develop bots and drones to do sampling at the top of the canopy. The biggest thing is power, and because we can power a lot of the equipment, including even doing the inactivation and extraction in the rainforest in black boxes, but there's only so much sun. So only on the rivers can you get the solar to keep everything powered up. So there's some real challenges there, but I think very interesting, ways to move forward. And just moving a little bit even more into climate change, continuing to use telemetry and other things. This is a paper I did before the Predict project with colleagues from USGS and Alaska Fish and Wildlife and many others, to look at new viruses, especially phocine distemper virus, that we were finding in the Pacific Ocean, and it had never been in the Pacific Ocean before. It was the culprit of mass die-offs of seals in the North Sea and Atlantic Ocean, but it had not moved into the Pacific. And we were able to actually document when it moved into susceptible new species. And in this case, I was studying sea otters at the time. And we were able to go back and look at the polar ice cap there on the left. And we detected that virus in 2004, I believe. I have to go back and refresh my memory, but you can see the polar ice cap is complete in 1988. In 2002, it's starting to break down, and in 2005, it's completely open. And so the radio telemetry on many of these, each color is a different species that we monitored, that species that didn't cross before, and we could see that these species both coming up from the Pacific into the Atlantic and from the Atlantic into the Pacific. So there was new mixing of species and sharing of viruses in that window where we started to detect a new virus, which is, again, not a human health connection to climate change, but a huge indicator, a health indicator of climate change really affecting directly our exposure to dangerous pathogens. So I just have a bunch of zoonoses that we are watching and seeing moving with the changing of migration of animals, as well as the opportunity because of climate and their habitat shrinking and other things. All right, so what do we do? I can just tell you what we're doing at Davis. I was sort of tapped to move from my PI researcher role into an administrative role to try and unite the thousands of researchers. We have 11 schools and colleges on the Davis campus, everything from nursing medicine, veterinary medicine, to law, environmental planning, engineering. So we wanted to unite the social sciences, especially with the STEM disciplines, to try and take a bigger bite out of these horrible problems that we're seeing that are accelerating on our planet. So we sort of took from the grassroots what the campus community felt like they had expertise in, that they wanted to do better, wanted to have more of an impact. And we did a process to select the grand challenges that our campus would try to attack. And then we put more effort, mostly human resources, into helping folks attack those problems. Added grant writer, added programs for basically doing think tanks and convenings and bringing people together to work together in ways that they hadn't worked together before. And we wanted to transform how our faculty were working and be a better land grant university, because we are a public land grant university. That land grant universities were built to actually serve our society. But we didn't change any of the way we evaluate or promote our faculty to be able to allow them to get promoted for serving society, right? We only looked at how they do with publications and their H-index and all of those things that every traditional university looks at. So we're trying to actually change those processes on our campus and our culture. So emerging health threats, I've talked about. That's one that was identified that we had expertise in, and we thought we could do better by pulling together. I think especially in this realm, disinformation and actually science literacy on the K through 12 or general household level were areas that we really wanted to improve. In doing things like I mentioned, the convenings, we were able to bring together universities that had done some great things during the pandemic and sort of rescued their public health systems. We were able to bring them and their public health partners together to say, what did it take to do that? And how did you do that? And what are you going to do to keep that going? And we actually did produce a roadmap for universities and the public health partners to work together so that we don't have the huge delay we had to have an on-ramp into the public health system. Davis did a great thing. We were testing every citizen in our whole county and the Sacramento International Airport every 4 days, and we were able to keep businesses and schools open because of that. But that's because we had the ability to do that. And it took us about a year to get that ramped up, mostly because of bureaucratic obstacles like CLIA. So we just can't go back to that. We should be able to get that going on day one next time, right? And unfortunately, all the rules and everything that were in the way are back in place again. So we really would love it if people were be willing to think about this at their universities and engage on a continuous basis. H5N1, another great example. Gigi helped me out with an emergency consultation that developed a policy brief. We've done briefings now in DC and are encouraging our policymakers to think of universities as a natural National Guard system for both the knowledge that they can impart and also the workforce that's available, the very highly trained and technical workforce that's available in universities. We also were able to come up with a research agenda out of that work. And you can see the very number one recommendation out of that research agenda, which is really 2 pages long, but the very top one is to work on things that shed light on vulnerabilities, and back to my concern with the One Health definitions. The climate crisis, I think I've talked about quite enough, and we all are aware, but the climate solutions is where we're working very hard on our campus. That connects, as I mentioned, to emerging health threats, and it also connects deeply to our third sustainable food systems. Davis is very well regarded, ranked usually number 1 in food and agriculture nationally, and often 1 or 2 internationally. We have more than 5,000 researchers working in the food system, yet most of them don't know each other and aren't working across disciplines. So we started to look at our own situation in California, work at home first. And actually around the outside of this blue pie chart is things that we are working to accelerate. We were already doing, but we're working to accelerate. And you can see the diversity of programs that we have, but that aren't working together to actually make change in the food system. So we're trying to do that now. So we do everything from looking at best agricultural practices that actually capture carbon and don't destroy the soil for the next crop, all the way to processing new foods and food additives that give you access, your body access to more proteins, the climate problems with distribution and farm equipment. A third of all greenhouse gases are coming from the food system, and about 70% of those are coming from transportation. And so we really just need to get after that, electrify the grid. So it's the whole cycle, all the way to using the waste from our food system to actually power the grid and provide natural fertilizer that's less damaging to the environment. So these are just some examples of how the food systems and climate solutions are also working together. You can see my sort of One Health, it's always at the intersection for me. So emerging health threats, sustainable food system, and climate solutions are all so related. I'm thrilled that our campus chose ones that were overlapping. And perhaps, again, if we go upstream, we can work to address them more effectively. And our fourth is reimagining the land-grant university. I already gave a little hint towards that, but this is just making us more service-oriented. And we started actually with our local tribes, because the land-grant universities are also called land-grab universities. We took the land from indigenous peoples by eminent domain and built our universities and sold their land for endowments, and haven't been respectful to the thousands of years of research that the tribes have been doing, that for us in California is actually better wildfire management than we've done with sort of white settler research. So starting to bring in those communities, understand how we might repair relationships, repay for the damages that have happened, and learn together and blend sort of traditional Western research with the native and tribal work that has gone on so well for so long. So you can see some of the things that we're doing there. And I'm proud to say we now have a senior strategic advisor on Native American, Alaskan Native, and First Nation affairs. So we have a position just to interact with the tribes. For some universities, just having one position sounds like that's pretty small. We actually have a whole bunch of committees and things that back that up, but most universities don't have one, and it took us a long time to get one. So we're really happy that we're finally on the right path. We want to do more. So we have a plan to actually bring together all of the disciplines in a new kind of building for our campus, where no deans are in charge of the space. The space is actually driven by the people that need to use it and work together across disciplines, so that we're not so siloed up. We're piloting this. I hope to be able to tell you that it's been a successful effort, but who knows? So that's my journey and my talk for today, and I'd be happy to take questions, and looking forward to talking to the students.
That was wonderful, and such a great description of so many. There's, I'm sure, going to be a lot of questions. So I will let you handle raised hands, but
Sure.
I would love to just start off, if you could comment a little bit more about what you think is going on, or what you would like to see with the current situation in H5N1 and dairy cows.
Sure. So Gigi and I moderated a session that brought in right sort of at the beginning, when we were planning it, before we knew we had any dairy cattle impacted from H5N1. But by the time we were able to get online with all these folks, many from around the world, it had moved into and been detected in dairy cattle. I think my big concern is that not that H5N1 necessarily is going to be terrible for us. My big concern is that it should prove to us that we learned nothing from the COVID-19 pandemic. So we did nothing. So our team actually was working in South America and was seeing the dramatic impacts on wildlife, especially seals and sea lions. So there were tens of thousands of dead seals and sea lions in colonies. And people were still saying that there was no mammal to mammal transmission. We didn't need to worry about it. We're saying, hey, folks, we have to be thinking about the early alerts, which actually drove us to do that emergency consultation. And even on the emergency consultation, and I'm not going to call anybody out specifically, but I was concerned that our agency, our federal agency that's responsible for our food supply, said, hey, we've only known about this for the last couple of weeks, when it has been going on for years and had accelerated and moved into mammal to mammal transmission months before. So this is my concern, is that we're so siloed up that the agencies that need to be integrated are not talking to each other. And I don't want to call it complacency. I know that people are great and they care, but they kind of are like, it's not my problem yet. I'll deal with it when it gets here, which is exactly what we had during the pandemic, and a lot of finger pointing. Must be you, must be you, instead of figuring out a system where we all work together. Now, I have worked with Senator Gillibrand from New York's office for 2 years about to look at this, and kind of dropped off because it looked like the legislation that we were trying to do for One Health was going to go away. But I'm pleased to say, in my last visit to that office a couple of months ago, they confirmed that they are moving forward with the One Health Security Act now, and that if that goes through, it will create an office in OSTP in the White House that will have a director and funding to be able to actually coordinate all the agencies from a One Health perspective. Now, one thing that was really disappointing is that when we were first working on that bill, it had both an industry component to actually harness industry for emergencies, that because there's a willing community that didn't get tapped, and to harness the academic community, as I mentioned back when I was talking about the emergency consultation. The academic part got taken out by someone, and I don't know who took it out, but I can say it suspiciously happened when it became a bipartisan bill. The industry liaison stayed in and the academic came out. Now, that bill needs a House side companion bill, and I've already spoken to legislators that are willing to make that companion bill happen and put the academics back in. So fingers crossed. But yeah, I guess to answer you more specifically, I'm just super, super worried because both it didn't change. It was evidence that we didn't change how we're structured and how we're thinking. And now that it hasn't been super devastating to humans, people don't care about it.
Right.
And that's super worrying.
Mm.
Anna.
Anna?
Uh, yes. On that note, so I was wondering, I was looking at your map early on in your talk when you were like fabulous work getting all those labs, new infrastructure and capacity building in Africa and Southeast Asia, and I keep coming to the fact that even in the United States, like we have some areas in the United States that are officially operating like in East Africa and Southeast Asia,
Yeah.
you know, like so isolated and so, I guess, misinformed. Is there some effort to maybe try to bridge and jump into that area?
Yeah, boy, we've tried with several agencies to help make that happen. Actually, during the pandemic, at the beginning of the pandemic, I was meeting with FDA weekly, and they were looking to change everything. That sort of moved to monthly, quarterly, and then dropped off. And they just, I think because the pandemic went so long, people really fatigued and wanted, I mean, we're humans, so we want to just put it in a box in the rear view. And the conversation went from we walk by into the FDA building every day, our mission, which includes disease prevention, and yet we don't do disease prevention other than vaccine development. We don't really do disease prevention. We have to change that. Obviously, we didn't protect the American people all the way to, yeah, we just have to go back and do what we were doing before. So please try. I'm not feeling very optimistic for the next few years, but we all should keep working. And what I do think is potentially optimistic is this National Guard kind of concept. A colleague of mine who was on Predict as well is now the director of the One Health Institute at Colorado State University, Tracy Goldstein. She's trying to pull together a North American One Health University network, sort of like we did with the One Health workforce in those universities in Africa and Southeast Asia. We don't have that here, so she's trying to pull that together. And I've suggested to that network that this National Guard system for universities to be tapped sort of early and often might be a less controversial way to get started. Salvatore?
Hi. So my question is, we're, not kind of like you had mentioned, it's not at the forefront of like dangers, I guess, in people's minds, like, oh, there's not gonna be another pandemic for some years. So how do we, I guess, we or government officials or basically anybody in academia, how are we like talking to the public about this? Like, how do we get people more engaged? Because I don't think that people don't necessarily care. I think it's that they're like uninformed and don't actually really understand how much of a pressing need this is.
Yeah, I agree with you. And this is why I'm just starting to think about it and scratch the surface, but I did a lot of podcasts during the pandemic, which seemed to be actually really great way to touch the general public in a fun and interesting way if you get on the ones that are fun and interesting. Which I didn't always, but I do think people really listen to podcasts right now. I think that's always going to be a changing landscape. Like, what are they, we're off Twitter, but we're on it, Instagram. I'm not, but, people are. So I think really working with the communication community and the scientific literacy, the education community is what we need to do. So I'm proud of my university for looking at that and trying to do it, but we haven't done it successfully yet. But I do think if we change the mindset of people, so I don't know, you're much younger than I am, but when you went to school, were you trained like me? You had to memorize photosynthesis, the cycle, and then later in high school, the Krebs cycle and things. Like memorizing those cycles, it is ridiculous in this day and age when anybody can look down at their phone and see what they needed. What we need is people to understand how science works, right? So that they don't say scientists are full of baloney because yesterday you told me to wash my hands and today you're telling me to wear a mask. I don't believe anything you say because I've been trying to do everything you say and it's still getting out of control, right? So that the process of iterative hypothesis testing that brings us to the next step is not generally taught until maybe senior in high school. Too late for the little kids to be educating their parents, which is what happens in sort of K-8, right? So I really think working on, as faculty, even if we're faculty in STEM with 2 M's, right? Medicine in there too. I think even working in our discipline is fine, but I think we have to be willing to put ourselves out there, sometimes be in the public domain and be wrong, and be okay with that and explain why that's okay and work with our colleagues in education and communication is maybe the most important thing we can do.
Could I take the prerogative of, my moderator's prerogative here to ask the last question about, you presented so much amazing data that was gathered through the Predict project and all this information that you gathered. I think sometimes people get the impression that it's kind of all figured out, like how these diseases emerge. And I wonder if you could just reflect for a little bit about what are some of the unknowns and the things, what you would like to see more research in.
I would say, again, why I called it an expensive pilot project. I would say the big success there is the capacity strengthening, the labs, and the One Health approach. The virology part, the answer is we found out that we know nothing, right? We found out we know almost nothing. We were able to collect pilot data to say, to understand viruses, it would again cost about $4 billion. All countries working together. It doesn't have to be US money. All the countries that already fund work. And we were making the argument, WHO's like, wow, that's cheap. It costs us trillions to do pandemics. And people are like, yeah, but who has $4 billion, and then we, had horrible, devastating human costs, as well as trillions and trillions of dollars lost. So the answer is, until we really get after it, we don't know much about viruses. We know much more about bacteria. They're a little bit easier, less expensive to study in low resource environments. Now we have a pretty effective and efficient and cost way to do that in all environments, and the more advanced technology is getting cheaper and cheaper. So what we know is that we need to do more work, and that work is possible and affordable, and that we really can't afford not to, both when we consider human lives and when we consider the cost.